Hi everyone, my name is Jessica. I'm one of the co-founders of Neuron. I'll give you a quick background on me. I started my career as a physical and organic chemist working with the American Board of Oral Implantology, researching ways that bone morphogenic protein, which is traditionally used in spinal fusion surgeries, could be used intraorally. My responsibilities in these years of research were to do volumetric 3D and 360 capture, pre and post-operative, to evaluate the success of the bone growth, to manage the feeding of the substrate to find ways that it grew better and faster, and to systemize a surgical technique. You have a very short amount of time to use the protein. But ultimately, I decided to follow my vocation. I'm a very creative person. I like going into places where people like to talk and like you, not going into places where people hate you off the bat. And so I became a partner at a creative agency. And my task was to find ways to engage audiences and engage people with their favorite brands using technology in new ways. And in 2015, I found virtual reality. So we were creating Black Friday doorbusters with national retailers, live event activations, music festivals, bringing you to places that if you attended them or didn't attend, you would never have access to otherwise. But along this journey, we created a very impactful narrative experience with this artist, and following his inspiration, what his journey was from a street artist to a renowned fine artist, and it got a lot of accolades. In order to get some of these scenes of walking and being with him painting without rigging and tracking, we invented hardware that wasn't available in VR at the time. And this, after getting some accolades, got a very serious phone call. The artist called us and told us that 6 months after seeing the VR exercise and enjoying it, his niece was doing a back bend in her living room and had a spinal stroke, complete freak accident. And she became paralyzed from the waist down. But she had seen the VR experience that we created with her uncle, and she thought that she was there. She kept telling her parents, remember when we were back in LA with Uncle Greg? And every time they told her, no, Eden, you saw it in VR, she was so mad at them. She couldn't figure out, why are my parents lying to me? So in their quest to do anything to help their daughter achieve more mobility in life, whether she may never walk again, they called us and said, is there anything you can do to help our daughter? She is absolutely tricked. And something that her mom said to us on day one, I flew out and spent a month there attending rehab with her every single day before school for 2 hours, learning what are the principles of recovery, the desired outcomes, the secondary outcomes, how can you prevent secondary injury? And her mom said, if life was just about Eden walking again, it would be so easy. How do you grow into an adult body? If she drops her pen at school, how can she have the core strength and stability to bend over in her wheelchair and pick it up without needing a caregiver there for her, and live the most normal life and independently as she could? So when we flew out, we went with a VR headset to see, can her little head support the weight? Is it going to make her nauseous? Will she enjoy it? And we put an experience on that was not designed to be used in healthcare, not designed to be therapeutic. It was of Christian Hosoi skateboarding in the Vans pool. And she was doing a crawling exercise where she's supposed to pull her knees and try to engage her core. Where at 5 years old, for anyone in the room that has kids, you know that 5 years old is like the, I'm a big kid now, babies are not cool. And she's back to crawling. She's back to wearing a diaper. The muscles in her digestive system are affected. And she made it a game. She was trying to hit his skateboard away. She's crawling. She's laughing. I'm like, OK, cool. She can wear the headset. This is a good start. Her doctors pulled us to the side and told us what they saw. She's exerting herself with higher intensity for a longer period of time. She's not complaining about the pain. Her self-imposed limitations are gone, and her mental health is through the roof. And this was really an aha moment. I saw it as an opportunity to bring my love for science back into a creative way in a scientific field, and to be much more impactful with the way that we could use this powerful technology. So we founded Neuron. And the name Neuron stands for a combination of the words mirror neurons. We want to trick the brain into exercising goal-related motor actions. So I have a very American example for you on what that is. If you see a baseball pitcher and catcher throwing the baseball back and forth, your eyes eventually will go to the mitt before the ball gets there because your brain has deciphered the outcome of the pattern. That's your mirror neurons at work. So with incorporating Neuron into rehab, and we know this across the board with so many different applications, it's more motivating, it's more accessible, you have it more engaging, more immersive. You're not just in there doing work, you're participating in fun games. And something that was said in the last session was, you get to be playful. Well, that isn't only for kids. Adults like to be playful too. And when you're in those immersive environments, it kind of allows you to really fully engage in that way. So there is, what we call virtual reality neurotherapy. How do we designate what's designed to be used in the healthcare setting versus what you might find on the gaming stores? You can't put someone that had a brain injury or a stroke into some experiences that have lasers and strobe effects, like some popular games. So making those considerations, and also how can we develop for people that have limited mobility, limited dexterity, making sure that they can fully participate without frustrations, especially in a world that's not built to traditionally be accessible in those ways. So we created a proprietary code base to accomplish this. There's a backend that helps practitioners track dosage and compliance, and a front patient-facing program that covers mobility exercises, mental health and pain management techniques, and we're basing everything off of those established gold standards in physical therapy, occupational therapy, and pain management. And we want to take this on a holistic approach. We're considering your overall health. How can you recover physically, but also mentally and emotionally? If you have a life-changing injury, you're probably dealing with depression, anxiety, finding a way to live this new life. So we want to make sure that when you're in rehab, you have these tools so that you're not doing the same thing every single time. It's not so monotonous. It's not like going to the gym and getting bored. When we first spent the month learning the rehab outcomes, we decided that it's very important to have a tool that fits versatile with other equipment that's found in the rehab setting. So whether in that center photo, it's a gait training exercise, learning to walk again. In the top corner, we have stroke, doing gross and fine motor skills. And in the bottom, we have a woman that has Parkinson's disease, doing squatting exercises in VR to reduce the risk of falling. Some of these conditions I mentioned may have short recovery periods. Some may have a lifetime of going to rehab and doing these adaptations. But the important thing is it has to be easy to implement. Healthcare providers need to be able to get it on someone in a minute or two or less, not eat into a substantial amount of treatment time getting them set up. They have to be able to have the end user have fun in it, because as the healthcare provider likes it, but the end user can't participate, it's not going to work. So making sure those integration elements are considered. I'll talk about specific ways in some of these different areas that Miron is integrated. In stroke recovery, it's a big thing to combine both motor function and cognitive function. When you're engaging both of those parts of the brain at the same time, they compound the effects of one another. So you can see in that top photo, he's doing speech therapy while he's doing these gross motor skills. So while he's tracing a shape, his practitioner is having him also say the shape and the color of the shape. So engaging him in 3 separate ways. In the middle, we have paralysis and functional electrical stimulation. So while those electrical impulses are being sent to the muscle groups, it's also in the experience giving you a task that's driven to actually neurologically stimulate you as you know it with those muscle groups. So if you're biking, you're not just on a recumbent bike looking at the wall, you're actually in these forward moving exercises so you feel like you're out on a bike ride. Patients have more output when they combine VR with those sessions, and it's more motivating for them to actually try to exert instead of just going through the motions. And then we're also implemented with neurodegenerative disorders like cerebral palsy, Parkinson's, MS. In this bottom photo, you see pediatric CP, where Miron is described as a new way to play and learn. So they are combining a couple of different pieces of technology, the Miron headset, a TheraSuit, and a Bosu ball. So really challenging that balance. They're doing ANTR reflex integration, really trying to build up mass and stretch out the affected side of the body. So especially in children where ADHD may also be a consideration, they're in the facility, they see someone else doing something that they might want to be doing. This removes all those distractions, and now they're focused on the task at hand. Like I said, it's versatile, so we deploy it as a full kit in kiosk mode. Some of the considerations that are extremely important is making sure that people cannot access content that's not designed to be in there. Like Dr. Asher was saying before me, spatial audio is a huge consideration, because as long as you can make it immersive and it feels natural, it's going to be more engaging. There is a study by PricewaterhouseCoopers that indicates that VR makes people 4 times more emotionally connected to their outcomes, 4 times more focused. Now, if we look at this in the healthcare setting, if you're emotionally connected to your outcomes, you're going to participate in your rehab more. I think of it as like being a bodybuilder versus going to the gym recreationally. If you're a bodybuilder, you're really focusing on making sure that you build that muscle mass versus if you're going to the gym, you know you should be healthy. And there's a couple things with people with disabilities. If they stop going to rehab, they don't just lose, muscle mass and maybe put on a couple pounds. That's losing independence. That means not being able to self-dress or self-hygiene, needing a caregiver 24/7, which is not only an emotional burden, but obviously a financial one as well. So I'll go through a couple of specific anecdotes and uses so you can see how it's used. Ryan here is a C4 spinal cord injury. He's paralyzed from the neck down. His goals are to be able to independently chair transfer so he can get out of bed for himself in the morning, and also so that he'll be able to drive with adaptive equipment. We're working on doing weight-bearing exercises, which are essential for spinal cord injuries. If you don't put weight on your bones, they disintegrate. It's a very painful exercise for him. He has a lot of neuropathic pain. So he was able to be in a stander for 5 minutes. With using VR technology, his average stander time is 15 minutes. Because when you're in these immersive environments, due to what they call the sensory gate theory, your brain has to pick what it's going to process. And one of the first things that your brain puts to the back burner is pain perception. So if he's not thinking about the pain, now not only is he doing the standing, but he's actually doing these upper extremity and core exercises so that he's also weight shifting, he's engaging different muscle groups, he's not just doing it until the next commercial TV break. Here we have stroke with brain injury, and I talked about that, so I'm going to do this one quickly, but there's sensory training, we have recall and brain games. No 2 strokes are the same. Some people have speech and cognitive to bear, repair. Some people need mobility improvement. So the versatility of the exercises allows something that you may use for spinal cord injury to also be used over here with a brain injury. You can see that his practitioner is co-viewing on a tablet, so he's involved in the session. It's not a solitary experience where you're just wondering, did it start? Are you doing it yet? You can direct those sessions. So when it comes to doing gross motor skills, if one area on the peripheral is not getting any action, you can say, hey, I want you to focus on those yellow targets over here and be involved in how they're using it. And again, pediatric CP, again, we see a Bosu ball here, really challenging the balance. And I think that this photo in particular shows how important this is to be a tool for intervention. It's not meant to replace physical therapists or to stand instead of it. You can see that obviously the physical therapist is right there, making sure that their pediatric patient does not fall. They're there to provide a quality of intervention, and it's a tool that helps make their job easier and more fun. FES is one of my favorite ways that Miron is used along with gait training. We have patients reporting more sensation in affected areas when Miron is paired with FES. That is a study that we're kicking off with Craig Hospital using fMRI to evaluate if it is, more of a placebo effect or if the brain is actually being activated in new ways. And the same thing goes for gait training. I'll come back to neuropathic pain. When we put Miron on in gait training, if you've asked someone that has a spinal cord injury to imagine walking, their brain lights up differently than someone that's able-bodied because their body is processing those inputs differently on a daily basis. When they're in this forward-moving environment, we see a reciprocal arm motion come back into play. So it's something that probably nobody in this room thinks about, but when we leave, look around outside and see how people are walking around. It's rare that you'll see people walking around with their arms just by their sides. But in a hospital setting, so many times on a locomotor or TheraStride, the arms are not engaged. Well, if they're engaging them when these gait training experiences are on, it tells us that the brain is activated in new ways. So improving those body functions, improving balance, doing those weight bearing, making it last for longer. And when we talk about neuropathic pain with Ryan and the stander, doing the gait training, the Journal of Neuroscience Research has indicated that opioids increase the development of pain and decrease locomotor function after spinal cord injury. Not only that, but there's a huge complication where opioids in anyone can cause septic buildup, something that is highly preventable that you don't want to end up back in the hospital for. And obviously the addiction factor. How can we make sure that people aren't getting addicted to something that they shouldn't be taking it in the first place to help their recovery necessarily. I'm going to show a quick video of gait training. This one's a little bit older. You're going to see it on a headset that has a phone, but Amanda Boxtel was CNN Hero of the Year. This is her first time trying gait training with VR. Typically, she's in a robotic exoskeleton. She had never done it harnessed up before. When she first started, it was awkward. She was frustrated, and here she goes.
It's just really cool. I'm walking along this beautiful path, and there's a park and a guy on the seat on the left, and there's the ocean on the right. This is really cool, you guys. I feel like I'm doing it, and I'm walking. I'm doing it while I'm getting a workout, but I'm not thinking of my workout. Before I was all focused on my legs and what do I need to do. Right, and am I doing it properly? But then everything fell into sync, and I was enjoying the experience of walking outside, and as if I was doing it myself.
3, 2, 1, go.
I love the part where they're starting again, and she can't wait to go back into the experience. So we have some testimonials. I have some end user. We're patient-facing programs, so it's important to hear what they're saying. Obviously, the practitioners have to love it too. But we have people pushing their bodies farther than they thought they could. It's hard to activate certain muscle groups, but they're pushing through that pain and doing more reps. More reps equals more outcomes. Really challenging limitations of what they thought balance was versus pushing themselves farther. Taking their rehab into their own control with more motivation. And then this last one is one of my favorites. Jill, a stroke survivor, in her 70s, doesn't identify as a tech enthusiast, has never played video games in her life, didn't want to try it, but I was doing an in-service that day, and her practitioner was like, you know what? I'm the boss of you for this hour. We're going to do it. And she came in that day frustrated, thinking that she was losing her ability to drive. She couldn't lift her arm to shoulder level. How am I going to turn the steering wheel? How am I going to get my groceries? And when she was in the experience, all of a sudden, she's popping these balloons and hitting targets, doing her PNF patterns overhead. And I went to nudge her practitioner. I thought she couldn't do that. And they're like, shh, 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 don't say anything. They took a video of her doing it. And at the end of her session, she was like, man, I'm so sore back here. I knew this wasn't going to be good for me. And they're like, no, Jill, you've been letting those muscles atrophy for this last 6 months. Look at what you can do. And she was brought to tears seeing her arm above shoulder height. I don't know if she ever used Miron again because it wasn't necessarily her favorite type of therapy going into it beforehand, but it certainly changed her perception on what was possible with her outcomes. So we're here to elevate the patient experience. I already talked about doing anxiety relief. There's stress management. You can do getaways, and that comes into the versatility of it. During COVID, we heard that gait training was being used for people to feel like they got out of the house. We created a telehealth system with the CARES Act to be where physical therapists in the US have never been telehealth eligible before. The CARES Act made that possible. So we created a tool where you could collaborate remotely. Hospitals would send the headset out to their patient in their home. They would log into a session together and evaluate range of motion and do different exercises. We also implemented dosage and compliance tools so that you could see, are they doing the homework you assigned them? For how long? Is their number of reps increasing over time? But COVID also spread widespread light on loneliness, depression, anxiety. So we've really focused on building more of our mental health library. Going forward, we don't know if the emergency order is going to keep these telehealth codes open, but with 5G, the metaverse, and the CARES Act, it's really opening light on how some rural populations, and especially people with disabilities, are extremely underserved. Do you have reliable transportation to get to rehab? If you live in a place that has snow and ice, are you going out during the winter in a wheelchair? So gait training was one of those things where people that were bored in the house and immunocompromised and couldn't even go out to get groceries were able to go for walks on the beach, in the forests, on these different trails, and not feel like they were stuck, versus the way that we intended it to be designed for, to be used with gait training equipment like the Locomat there or harnessed up TheraStrides. We also, along with having our CGI gamified experiences that do those PT and OT principles, have a library of wellness escapes, so guided meditations, places that you may never be able to travel to. Sometimes it's stressful, sometimes you're feeling like you're not accomplishing their goals in the amount of time that you want. Take a little escape with one of these mental health experts. So we've developed it to be an effective and easy solution built on gold standard techniques, reducing the risk of secondary injury, using it in person or online, tracking progress with real-time feedback, and being able to monitor dosage and compliance in real time and after the fact. It's HIPAA compliant, which is extremely important. There's no personal identifying information going into the platform, #1 concern for hospitals. It can be used for the neurologically engaging aspects, also for cardiovascular health. So there's a wide array in which it's implemented across the healthcare spectrum. There's a tremendous amount of existing research, of ongoing and upcoming research. With us, we have research related to pain management, to range of motion and functional mobility, to mental health, and to combating the epidemic of opioid use. And there's a lot of interested parties that want to participate in research. We have Craig Hospital that deals exclusively with spinal cord injury and brain injuries. How can we have people achieve more functional mobility? The Rockefeller Neuroscience Institute that has great interest in pain management. United Spinal Association in partnership with Qualcomm on how we can reach rural populations and people that don't have reliable access to go into a PT center once or twice or let alone 3 times a week. And with the VA in Palo Alto has administered us for telehealth, so we're studying efficacy for shoulder range of motion remotely. Miron is adopted internationally, so that's why I'm participating out here in an international conference. We're in hospitals and outpatient rehab centers around the world. And it's always interesting to see one thing that we may develop to serve one type of condition and how practitioners, I always say physical therapists are the most creative healthcare providers out there because they have to find new ways to engage different people. We take surveys and feedback from practitioners all over the world to continually update and improve our library. And our team in 2020 won a CES award for innovative technology, specifically for designing technology to improve the lives of people with disabilities and the elderly. So this is our team, Miron, developing. You can see there's a lot of different types of people in our team. We develop with diversity in mind. So my hands are different than our senior developer. Rock's hands are different from, Joel's hairy hands. Sorry, Joel, if you're watching. But how can we all feel embodied in these experiences without eating up practitioner time, making custom avatars? Obviously has its place in certain scenarios, but for us, the headsets being used over here at gait training, over there with the Bosu ball, has to be quick and easy to move around the facility. So that's all I have to share on this, and I look forward to questions.
Yeah, super cool. Thanks. Yeah, I got in a little late, so I might have missed something, and maybe you talked about it at the beginning. So have you also worked with amputee patients and phantom limb? Like there used to be that old method where you just move a mirror and then, you have a mirror and then you move your abled arm and you see the...
Yes. So mirror therapy is, still considered the gold standard in that. And we get a lot of requests to create mirror therapy in our program. The reason that we have not implemented it is simply because the most effective way is that you're seeing your leg, the opposite of your leg. So whether you have freckles, your skin tone, scars, all of those things play a factor into why your brain believes that it's moving. We do have amputees that participate in Miron exercises for balance and weight shifting, also core engagement and doing squats, but we haven't made a specific mirror therapy exercise yet. It is something that comes up quite frequently.
I was just curious, obviously with patients using the device, there's a lot of sensor data that's building up as they're using it. Have you explored feeding that data into kind of clinical decision support at all and feeding that back to the practitioners so they can perhaps measure things like recovery rate and stuff like that?
Yes, so that's a great question. Through our years of R&D, there's a couple of considerations that are important. How long are the exercises? Because you're getting someone that may have never tried VR before. So we have an average exercise length of 3 minutes. Gait training is longer. That helps mitigate the photosensitivity, whether, how long does it take, how long of their treatment time is dedicated to VR, and then also making sure that they don't experience motion sickness. This is a conversation that's come up with the International Virtual Reality Healthcare Association, is how can we kind of standardize those practices to see, is an 8-minute experience more effective than a 3-minute? But it's a hard element to measure because how many times are people coming in? What's their treatment time? Do they have 40 minutes, an hour, 30 minutes? So being able to serve the patient in that way, I think, is important too. But it's definitely, I think, something that is going to play a more important role moving forward.
Jessica, last question. What, if you're presenting here next year in 12 months, what would you hope to be sharing?
In 12 months, I hope to be sharing a lot of qualitative data. So we've had a lot of research studies that were halfway through, and when COVID hit, they had to be paused. They've re-picked up right back now, but I know from what we were hearing from the providers that the correlations we were looking for were positive. So I'm looking forward to being able to share those statistics with you guys when the research pertaining to our particular uses are published.
Jessica, thank you very much.
Thank you.